and our topic for today is how to improve retention rates. Now, you may be wondering how this relates to building a practice. Is this more along the lines of clinical skills? And so, one thing that I don't want you to get the habit of is learning how to market so well that you get so many referrals and that you keep getting referrals, and then you keep cycling through your referrals and that maybe they're not staying with you in therapy. And so there's a couple of things that you can do, and really this is going to depend on your therapeutic style. Some people have a more person-centered style, kind of like a go with the flow style. Some people have more of a cognitive behavioral approach where they give homework and they maybe follow up with clients between sessions, depending on, again, whatever therapeutic approach that you use. And so I want you to honor your approach, but I also want you to think about how to best engage clients in therapy. So again, it's one thing to drive a bunch of referrals. This especially is true for group practices. If you're a solo practitioner and you're going and you're doing pretty well, you're probably doing okay with retention rates. But when you start to expand, maybe you bring on another clinician or you bring on 5 clinicians, you're going to be thinking about retention rates. I really think you should be thinking about retention rates at all times. So I really want you to take a look at what kind of therapy you do, because some therapy is more long-term than short-term. I get that. Some people are more solution-focused. So no matter your style and no matter the type of therapy you're doing or who your ideal client is, I want you to identify a key performance indicator around session retention. So on average, how many times a potential or your clients will come to you? And so if you are a DBT therapist who does a strict DBT program, that's 52 weeks, you're going to want to put that number at maybe 50, count for vacations or things like that, right? I know those numbers are not exactly, because sometimes you go to groups, but you get the idea. If you're a cognitive behavioral therapist, we know they say 8 sessions. A lot of information will say 16 sessions. So maybe you will say, yes, I'm a cognitive behavioral therapist, and for me to really be effective, my clients are going to come on average of 12 times. If you are a trauma therapist and you're doing deep work, that might be much longer. That might be 6 months, so that might be 20 sessions. But I really want you to think about clinically what would make your therapy most effective. Then I want you to start having those conversations right from the beginning, maybe even on those intake calls, and say, this is my style, this is my approach that I ask for clients, as long as we're a good fit. I know we have to sort of, be mindful of that. Not everybody's going to be a good fit at the intake, even if you do screening phone calls. And you say, my style is to do therapy this way. I'm most effective when I see people at least this amount of times. I really ask for people to commit to that. So we can do an intake, we'll do a treatment plan, and in your treatment plan, it'll identify how many times you come to session, how many times, the course of treatment. And I really ask that people stick to that, because my goal is to be as effective as I can for you. Then from there, you want to make sure that you're reviewing that treatment plan on a regular basis. If you give homework is a great way to keep people engaged in therapy, because they feel like they're doing something between session. Again, that's not for everybody, but you want to make sure that, yes, you are being mindful that you are giving homework to people, keeping them engaged, or doing something in between sessions to keep them engaged. I want to take a moment to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that's really full service, I want you to check out TherapyNotes. They are really great at customer service. They have a great electronic health record with a video option now. Yay for telehealth. So I want you to check out TherapyNotes if you're looking for an electronic health record. So going back to your key performance indicator of how many times people come, your retention rates, I want you to start tracking that for clients and see on average how often people do come. Maybe take a look at some of the statistics that you have for the past 6 months or the past year and see how often you keep clients, how often people come for just one session. I think there's a multitude of reasons why people come for one session. We do see that quite a bit. And then there's a lot of people, obviously, who stay for a long period of time. I think those one session people could be scared about therapy, it might not be a good fit. They might, have all kinds of reasons why they decide not to come back after that first time, but that might be something that you want to also find out so you can make sure that you are not just turning your wheels with getting people to come to therapy just once or twice or a few times, that you're really maximizing the therapeutic experience both for you and your client. I'm here most days answering your questions. I'll see you soon, everybody. Bye.